Understanding health insurance, your safety net. Health insurance is a crucial aspect of financial planning. It acts as a safety net, protecting you from the potentially devastating financial burden of unexpected medical emergencies. Imagine facing a sudden illness or accident. The medical bills alone could wipe out your savings. This is where health insurance steps in. It provides financial support covering a significant portion of your medical expenses. From hospitalization to surgeries, having health insurance ensures you can access quality healthcare without financial strain. However, navigating the world of health insurance can often feel like traversing a complex maze. There are numerous terms and conditions, and one such crucial aspect that often goes unnoticed is the concept of room rent limits. This seemingly minor detail can have a significant impact on your coverage and out-of-pocket expenses, especially during hospitalization. Room rent limits, as the term suggests, refer to the maximum amount your insurance policy will cover for your hospital room per day. While it might seem insignificant compared to the cost of major medical procedures, the choice of your hospital room can unexpectedly inflate your overall medical bill, especially if you exceed the prescribed limit. Let's say your policy has a room rent limit of $500 per day, and you choose a room costing $750. In such a scenario, you would be responsible for paying the difference of $250 per day out of your own pocket. This additional expense might seem manageable initially, but it can quickly add up, especially for prolonged hospital stays. Hospital administrator, media, financial impact of room rent limits on prolonged hospital stays. This additional expense might seem manageable initially, but it can quickly add up, especially for prolonged hospital stays. To understand the real-life implications of exceeding room rent limits, let's consider the case of Mr. Ramesh Chand. He opted for a slightly more expensive room at $600 per day, unaware of the potential consequences. Unfortunately, his surgery led to complications, extending his hospital stay to 10 days. His initial hospital bill amounted to $100,000, but his insurance company, citing his room rent limit of $500, only covered a portion of the expenses. Mr. M. Ramesh Chand, media man looking stressed while discussing medical expenses. Due to exceeding my room rent limit by just $100 per day, I ended up paying an additional $1,000 for my room alone. However, the consequences didn't stop there. The excess room rent triggered a cascade of proportionate deductions on other medical expenses, further increasing my out-of-pocket burden. The excess room rent triggered a cascade of proportionate deductions on other medical expenses, further increasing his out-of-pocket burden. Section 4. Proportionate deductions and non-medical expenses. Many policyholders are unaware of the proportionate deduction clause often embedded in their health insurance policies. This clause comes into play when you exceed the room rent limit. It essentially allows the insurance company to reduce their coverage for other medical expenses proportionally.
In Mr. Chand's case, the proportionate deduction meant that his insurance company also reduced their coverage for doctor's fees, surgery costs, and medicines. This significantly increased his final bill. Moreover, certain non-medical expenses incurred during hospitalization, such as food, attendance charges, and administrative fees, are often not covered by insurance.
Section 5. Room category and overall medical costs. Choosing a higher room category often translates to higher overall medical expenses. This is because hospitals sometimes link the fees for doctors, specialists, and even certain medical procedures to the room category you select. For instance, a specialist might charge more for consultation if you opt for a deluxe room compared to a standard room. Similarly, some diagnostic tests and procedures might have different price points based on room category. Therefore, while opting for a more comfortable room might seem appealing, it's essential to consider the potential impact on your overall medical expenses, especially if your insurance policy has a room rent limit. Section 6. Navigating medical inflation and choosing the right plan. The cost of healthcare is constantly on the rise. Medical inflation outpaces general inflation, meaning the coverage that seemed adequate a few years ago might fall short in today's scenario. This is where Understanding room rent limits and their implications becomes crucial.
When choosing a health insurance policy, it's vital to carefully assess your needs and consider factors beyond the premium amount. Opt for a policy with a room rent limit that aligns with your budget and healthcare preferences.
If you anticipate potential hospitalizations, discuss with your insurance provider the option of increasing your room rent limit.